Morning, everyone. Um, uh, Welcome to the morning session. It's the Symposium number 10 about tobacco control in China, challenges and opportunities. Today we have several speakers and we have two moderators for the sessions. Let me just introduce both moderators for you, and then I will hand over the session to the moderators. The first moderator, um, Dr. Mark Parascandola, is an epidemiologist with the Tobacco Control Research Branch in the Division of Cancer Control and Population Sciences at the National Cancer Institute. He received his doctorate in philosophy of science from Cambridge University and his Master of Public Health degree in epidemiology from Johns Hopkins University School of Hygiene and Public Health. Dr. Parascandola also completed an NCI Cancer Prevention Fellowship. He has authored numerous publications on tobacco use prevention, tobacco control policy, and epidemiologic research methodology. He also served as an editor for the NCI WHO report, The Economics of Tobacco and Tobacco Control, NCI CDC report, Smokeless Tobacco and Public Health, and several others. Um, for the second moderators, Dr. Xiaojing Wang is Global Professor of Neuroscience and Co-Director of the Sloan Swartz Center for Theoretical Neuroscience, both at New York University. She also serves as Associate Vice Chancellor to Research and Co-Director of NYU and CNU Institute of Brain and Cognitive Science and NYU Shanghai. Her research is at neurobiological mechanism and cognitive function and behavioral science. Both of them will be the moderator for our sessions today. Let me just hand over the session to our moderator. Please welcome Dr. Mark Parascandola and Dr. Xiaojing Wang.
Great, thank you. Well, welcome. So I'll just say a few words to get us started before we start to move into the talks. First of all, I just wanted to say, yes, it's great to be here virtually. Obviously, I think many of us had hoped to be in Bangkok in person, but because of the ongoing COVID pandemic, unfortunately, that wasn't possible. But I think, hopefully many of us are getting accustomed to virtual meetings, and I think we've been able to sort of continue to, have exchanges with colleagues around the world and through, being connected through technology. So it's great to be here. I wanted to say something about the session purpose here. So the focus here, of course, is on tobacco control in China, challenges and opportunities. And, part of the reason to focus on China is because obviously because of the sheer scale and size of the population and the country, it has tremendous impact on global sort of patterns of tobacco use and cancer. We also know that China, of course, is also the largest consumer of tobacco and also largest producer of tobacco worldwide. But at the same time, there are a lot of important lessons, I think, to be learned because of a lot of the innovative things that have been done, often at the local level, at the level of cities in tobacco control in China. So I think there are important lessons for the rest of the world as well. So I think we have an interesting mix of talks that talks about, some of what is happening in the tobacco control epidemic in China, some of the obstacles and challenges, and then also hearing about some of the work that's being done in the U.S. Comparing Chinese immigrants in the U.S. to to Chinese people in China. So again, I think this is an interesting opportunity for international sort of lessons through exchanging experience. And then one final thing. So we have had, unfortunately, we have we originally had 5 speakers slated. 2, unfortunately, were unable to join us. I think obviously this nature of the, logistics of the conference and the scheduling have changed. And so it's made it difficult for some folks maybe who had wanted to be here. We have 2 of the 5 talks, Xiaolin from the China CDC, who is going to be talking about evaluating progress against the tobacco epidemic in China, and also Jidong Huang from the University of Illinois, who is going to be talking about evaluating a smoking cessation intervention delivered via WeChat in China. So unfortunately, they're not going to be able to join us, but we do have the other 3 speakers here. So we can, move ahead into those talks. So I'll start with introducing my co-chair, who is going to give the first talk. So Dr. Xiaojing Wang is going to be talking about setting the stage for tobacco control in China. So she is Deputy Director for Tobacco Control and Road Safety at Vital Strategies at the Jinan Representative Office. She had earlier joined the International Union Against Tuberculosis and Lung Disease in 2015, working on tobacco control and road safety. And then when the union was merged into Vital Strategies, she became Deputy Director for Tobacco Control and Road Safety at Vital Strategies. So she's been working on tobacco control policy development and implementation in China, with a focus on smoke-free and tobacco tax policies and overseas implementation of grant government entities. She had also, before joining the union, worked at New York State Department of Health and Albany City Government, and has her master's in public administration from the Rockefeller College of Public Affairs and Policy at State University of New York in Albany, and a Bachelor of Arts from Capital Normal University. Dr. Wang, I'll turn it over to you to get us started.
Thank you very much, Dr. Mark. First of all, I'm actually honored and flattered to be introduced as a different person by our conference administrator. But thank you, Dr. Mark, for introducing me again. And just want to clarify that the merge, we talked about of the union, it just happened in China due to some administrative difficulties. So I'm actually giving the presentation still on behalf of the union today. So just want to clarify that. And I was trying to share my screen so I can present from my end, but it seems like the host just disabled that function. Is our conference administrator still on the line with us? Oh, there we go. Thank you very much.
Now? Okay, great.
Yes. All right. Good morning, good afternoon, and good evening, wherever you are. My name is Xiaojing Wang from the International Union Against Tuberculosis and Lung Disease. I'm going to give an overview of tobacco control in China today. I'll start with a brief history of FCTC ratification in China, followed by some changes in political and social environment. Then I'll quickly go through current implementation of the Empower policy in China and finish up with a brief summary of some of the challenges and opportunities. Now, China signed the Framework Convention on Tobacco Control in November 2003 and became the 77th party to the FCTC. About 2 years later, FCTC was ratified by the National People's Congress, the highest level national legislative body in China, and came into force in January 2006. Now let's talk about change of political environment. After FCTC got ratified in China, the original FCTC implementation Inter-Ministry Coordination Leading Group was established in 2007, led by the Ministry of Industry and Information Technology, which is the supervising agency of the State Tobacco Monopoly Administration, STMA, which is essentially the industry. STMA was also a member of the leading group and played a key role in developing the National Tobacco Control Plan back then. After the national level government reform in 2018, the responsibility was then given to the newly reformed National Health Commission, NHC, who then became the chair of the new FCTC Implementation Inter-Ministry Coordination Leading Group. Another key highlight is the new coordination mechanism included 6 new member agencies, as highlighted in red in the chart, who are in a relatively neutral position towards, if not in favor of, tobacco control. This not only provided opportunities for NHC or other tobacco control organizations to engage the new member agencies, to mobilize and leverage their support, but also diluted the power of STMA over FCTC implementation in China to some extent. Unfortunately, STMA, as you can see from the chart, remains as a member agency in the new coordination mechanism. Another political environment change happened after a government notice was issued. The General Office of the Central Committee of the Communist Party of China and the General Office of the State Council, basically the 2 highest level, most powerful government administrative entities, jointly issued a government notice calling government leaders to take the lead in anti-smoking in public places in 2013, which was quite influential and became the driving force behind the national initiative to create smoke-free government offices. The message was then re-emphasized by People's Daily, one of the most influential government official press, in late 2019, after the initial notice was released for 5 years, and just before release of a national health action plan that I'm going to talk about in a moment. The notice and its lasting effect led the foundation for creating 100% smoke-free government offices, which have a positive impact on promoting tobacco control policy at the subnational level. Now, in 2016, the national government released the Healthy China 2030 strategy, which is a national health development plan that outlined the principle to include health in all policymaking and emphasized that people's health development should always be the top priority of the country. The strategy also indicated specific goals for tobacco control, which includes reducing smoking rate of people 15 years old and older to 20% by 2030 for the first time. This provided a solid foundation for development of the Healthy China Action 2019 to 2030 that I mentioned in the last slide, which includes more specific tobacco control targets. Now, the tobacco control action is included as a standalone action in the Healthy China Action 2019 to 2030. As you can see from the translated version, the specific tobacco control targets were set for the year 2022 and 2030, including reducing smoking rate among people 15 years old and older to 24.5% and 20% and total population protected by comprehensive smoke-free legislation reaches 30% and 80% by 2022 and 2030, respectively. And all government offices achieving 100% smoke-free by 2022. Other than these targets, the Tobacco Control Action also outlined some indicators for individuals and society, encouraging individuals to quit, teachers and medical professionals to take the lead in tobacco control, and employers to provide smoke-free work environments for staff. In terms of social norm change, as you can see from the chart, public support for a complete indoor smoking ban in major public places increased in 2018 compared to the 2015 data. Besides that, several leading social media platforms equivalent to Twitter, Skype, WhatsApp, or Line in China replaced the smoking emoticon with newly designed ones on their platforms in recent years, just to help denormalize smoking behavior. Now, let's take a look at M-Power implementation in China. One major progress on the M policy is the national government sustained monitoring of tobacco use in China by supporting regular national youth tobacco survey and adult survey in alternating years with government funding. The results of the most recent adult and youth surveys were released just before the World No Tobacco Day in 2019 and 2020. As for the P policy, even though a national comprehensive smoke-free law is in absence, smoke-free momentum continues to grow at subnational level in China. More cities have adopted smoke-free policy through passing designated smoke-free law or other health or non-health laws, with more than a dozen adopting 100% smoke-free policy, covering all indoor public places, workplaces, and public transport. Local evidence has proven that implementation of 100% smoke-free policy plays an important role in reducing smoking prevalence in cities having 100% smoke-free law. This is true in first-tier cities like Beijing, Shanghai, and is also true in economically underdeveloped cities like Lanzhou in the northwest part of China. Decreased secondhand smoke exposure rates also demonstrated positive progress. As you can see from the charts, secondhand smoke exposure in almost all indoor public places, workplaces, and public transport continue to decrease, as indicated by the 2010, 2015, and 2018 adult tobacco survey results. It's also worth mentioning here that the smoking prevalence of overall people of 15 years old and older in China also tends to decrease from 28.1% in 2010 to 27.7% in 2015, and then to 26.6% in 2018, although there was no statistical significance. In addition, some cities also took the initiative to include ban of e-cigarette use in indoor public places in local smoke-free laws. And e-cigarette online sales and sales to minors are also banned currently in China. When it comes to taps ban, only tobacco advertising is banned in China after the national advertising law was passed and implemented in 2015, which bans tobacco advertising in mass media, public places, and on internet. Some cities adopted stronger ban that includes tobacco promotion and sponsorship, such as Beijing, Shenzhen, and Wuhan, but there's no national level policy at this moment. In addition, e-cigarette advertising is also banned on internet. With regard to tobacco tax, there was no progress in recent years after the last tobacco tax increase in 2015. I'm not going to get into the technical details, but as you can see from the chart, the 2015 tax increase successfully decreased tobacco consumption in China. Unfortunately, the positive effect of the 2015 tax increase was diminished as it didn't really decrease the affordability of cigarettes. However, it did prove that implementing tax measure is also effective in China. As for challenges and opportunities, I know my fellow colleagues are going to talk about it in much more detail. So I just want to give a quick overview here based on our experience working in China. Also, I'm not going to talk about general political issues today, but among all the challenges, including continuous impact of COVID-19, there are two that I want to highlight here. First, we have encountered much stronger industry interference at all levels in recent years. The industry, as I mentioned previously, which is essentially part of the government, is using a unified strategy, especially towards interfering with subnational policy development, which is very powerful and influential using their government entity. This is, also a good sign because it shows that the industry has seen negative impact of tobacco control policy development on industry development in China. But it also forces us as tobacco control advocates to be stronger and, more importantly, smarter to counter the interference. Second, we have observed a much stronger preference of the government agencies in generating China experience, telling China stories. This may and has already, in some places, create obstacles in using evidence and experience generated internationally, which urges us to explore new approaches to promote tobacco control in China, including leveraging supports from Chinese national initiatives, such as the Healthy China 2030 strategy and the Healthy China Action 2019 to 2030 that I mentioned in previous slides, and also seeking opportunities to produce local data and evidence. In terms of opportunities, apart from leveraging implementation of the national initiatives, supporting implementation of the newly adopted minors protection law that was just passed earlier this year at the subnational level, and using the youth protection angle to develop and launch campaigns are also opportunities for us in China, as there will be no entity opposing the critical importance to protect youth from tobacco harm, including the SCMA, the industry. In addition, there may be potential opportunities to promote smoke-free policy at a national level, and also the revision of the national philanthropy law to advance tobacco sponsorship ban in the coming year. With that, thank you very much for listening.
Great, thank you, Dr. Wang. So we, I think, we can take one or two questions initially on Dr. Wang's presentation. I guess if I understand it right, I think the participants are able to type questions into the chat. So feel free to do so if you have any questions now. If not, we can, sort of feel free to add your questions later, and we'll track them, and we can have some time for discussion at the end. So otherwise, if I don't see questions coming in yet. So otherwise, I'll go ahead and introduce our next speaker. So Dr. Xia Wan is professor at the Institute of Basic Medicine at Basic Medical Science at the Chinese Academy of Medical Sciences, at the School of Basic Medicine at the Peking Union Medical College. She's taken part in NIH supported projects and Bloomberg projects and the China Medical Board on tobacco control since 2007. She is PI for an NIH project and co-PI for two China Medical Board projects. She's also received awards from the Chinese Medical Association, Chinese Preventive Medicine Association, and the Ministry of Education for her work, and also a Global Tobacco Control Alumni Award for Excellence by the Institute of Global Tobacco Control at the Johns Hopkins School of Public Health in 2012, as well as the China Medical Board Faculty Development Award in 2013, and also a State Scholarship Fund Award in 2014. She has published more than 80 papers in Chinese and English, and has a long record of conducting research on tobacco control. So I'll turn it over to Dr. Wan.
Thank you, Mark. Can you hear me?
Yes, we can hear you.
Thank you, Mark, for your introduction. And
just so you know, your slides are in presentation mode now. Okay.
Okay. And good morning, everyone. I'm honored to be here to share the topic on overcoming obstacles to effective tobacco control in China with you. As Dr. Wang has given you a whole picture of tobacco control in China to you. In summary, China has made some progress on tobacco control in the last decade, but there is still a large gap between the implementation and the requirement of FCTC, especially during 2006 to 2011. And at that time, the implementation just got 37.3 points assessed by the domestic and international tobacco control experts. After 2011, Article 8, Article 13, and Article 6, the implementation there are some progress on these articles, but for the Article 14, the implementation is relatively poor. But for the Article 9 to 11, the implementation is quite poor. And therefore, China fall behind among the 182 parties of WHO FCTC. Now, this understanding was obstacles to standing in the way towards smoke-free China. We think there are three most important obstacles, including partial leading power on tobacco control grabbed by tobacco industry in China, and the performance of the government officials evaluated by GDP, and tobacco control campaign in China restricted by limit political and financial resources. I will give you a little bit information about the tobacco industry in China. China National Tobacco Corporation is the largest single manufacturer of tobacco products in the world. The CNTC is a state-owned monopoly over the tobacco industry, and also a government department called the State Tobacco Monopoly Administration, we call the STMA. The STMA also affiliated with the Chinese Ministry of Industry and Information Technology. As Dr. Wang mentioned, before 2018, there are 8 organizations composed of the Inter-Ministry Coordination and Steering Committee for implementation of the WHO FCTC in China. The MIIT was the chair of the whole community, and as you see, the STMA is stayed here. And actually, the MIIT implemented the FCTC through the STMA. After 2018, the government changed the function of the different ministry. So it's lucky the National Health Commission was the chair of the committee, but you can see the STMA still stayed in the committee. The second obstacle is the performance of government officials evaluated by GDP. Because in China, the development ideology of GDP first among governments. Therefore, the government concerned that tobacco consumption decline would hurt China's economy. So they are reluctant to conduct tobacco control in China. The third obstacle is the limit political and financial resources. Normally in China, the health promotion campaign is arranged by government departments, but not for tobacco control campaign. Most of the tobacco control campaign was conducted by various social communities. Chinese government put only a small amount of funds for routine tobacco use surveillance and the related health education. Therefore, there's a shortage of the resources from Chinese government. I can give you an example from the research of our team. We conducted a system review before 2020. From this side, you can see in the past 30 years, there are only 99 cohort studies related with the smoking use in China. And you can see there are only 47 papers mentioned that they get the funding support from the national level. And 44 papers mentioned that they get funding support from the international collaboration. So you can see there's much limit resources from the government. So we think there are 8 strategies to overcome the obstacles. One is to eliminate the obstruction of the tobacco industry in the tobacco control steering community. The second is to issue the national smoke-free law as soon as possible. The third one is to regularly issue the national plan of tobacco control. The fourth is to put tobacco control into the government performance assessment. The fifth is to strengthen public education and place the pictorial warning on the cigarette package. The sixth is to regularly monitor, evaluate, and report progress of tobacco control policy implementation. The seventh is to strengthen capacity building and ensure financial support for tobacco control. And the eighth is to build the coalitions of tobacco control. We hope we can move to the smoke-free China. Regarding to the first strategy, we think the STMA should be removed from any responsibility for tobacco control policy, and definitely it should be monitored by the community. About the second strategy to issue the national smoke-free law as soon as possible, you can see the current situation is here. The smoking prevalence of adult people is quite high. It's nearly to 27%, and only 13.5% of population are protected by complete smoking bans. As Dr. Wang mentioned, we have the government have issued the Healthy China Initiative from 2019 to 2030. In that required that smoking prevalence of people would be lower than 24.5% and 20% by 2022 and 2030 respectively, and 30% and 80% population will be protected by complete smoking bans by 2022 and 2030 respectively. You can see there's a huge gap here. We think the national smoke-free law will fill in the gap. About the smoke-free law situation, current situation for China is that more than 20 cities have passed smoke-free laws since 2008, and a draft national law requiring 100% smoke-free public places, workplaces, and public transport was developed in 2013. And fortunately, at that time, the proposal was quickly moved up to the top tier of the legislative plan. But unfortunately, the proposal was suspended. Now, the National Health Commission is calling for it and pushing forward to issuing it. And in order to accelerate the smoke-free law issuing, and in the last 2 years, the government issued some related smoke-free policies, such as the laws on the promotion of basic medical and health care. This is the first basic and comprehensive law in the healthcare field. In Article 78, there are some items related on the tobacco control. And also this year, the amended minor protection law enacted, as Dr. Wang has already mentioned before. It is the strongest policy for the youth. And in the law prohibits any kind of the behaviors to induce minors to use e-cigarettes and sell e-cigarettes to minors. And also some directives and notice on tobacco control to promote Healthy China initiative. We hope all these policy will be implemented well and also can accelerate the national smoke-free law issued. So we are looking forward to the national smoke-free law issuing. The third strategy is to regularly issue the National Plan of Tobacco Control. In 2012, the National Plan of Tobacco Control from 2012 to 2015 was issued. This is the first National Plan of the Tobacco Control. But after that, there's no any kind of the National Plan of Tobacco Control. Now, National Health Commission is working on the second national plan for the following 10 years, which was supposed to be issued at the end of last year, but still have not enacted finally. So we also look forward it will be issued soon. And the fourth strategy is to put tobacco control into the government performance assessment. At the end of the 2015, some of the goals of the National Plan of Tobacco Control was unachievable. Although this, not any departments take the blames for the unachievable goals. Like in the national plan, it requires smoking and prevalence in adolescents should decline from 11.5% in 2010 to below 8.5% in 2015, and the smoking prevalence in adults should decline from 28.1% to below 25%. But now we think we have an opportunity to put the TC into the government performance assessment, because in August 26, during the National Health Conference, President Xi has emphasized that we should put people's health into all policies as the strategic priority. So tobacco control is not a simple measure of public health, but an important part of innovative economic development and the strategy of sustainable development, as well as key indicators of Healthy China 2030. Therefore, the TC implementation of FCTC and the targets 3.4 and 3A of the SDG should be included as one of the assessment indicators for government performance. The fifth strategy is to strengthen public education and place the pictorial warning on the cigarette package. In 2008, the government released the regulation on cigarette packaging and labeling in territories of China, which ostensibly met the requirement of Article 11. In 2016, the labeling regulation was updated, but still did not compliance with the requirement of FCTC. So you can see the package on the package still very beautiful in China now. Therefore, the packaging must be redesigned with pictorial warnings and a message. The sixth strategy is to regularly monitor, evaluate, and report progress of tobacco control policy implementation. Currently, the surveillance system has become one service of the National Basic Public Health Services, and will conduct the survey every year. Before that, China updated the surveillance data almost every 5 years in 1996. 2002, 2010, 2015, and 2018. And the prevalence of tobacco use in China did not change a lot more than 10 years after WHO FCTC came in force in 2005, decreasing 1% and hovering around 27%. The surveillance system on tobacco control needs to be further improved in China because it couldn't effectively monitor the tobacco industry actively timely. I can give you an example. In 2012, we called the Low Tar, Low Risk Cigarettes campaign. At that time, a man from the tobacco industry, he declared that the low tar can reduce low tar cigarettes and the Chinese herbicide cigarettes can reduce the harm to the human bodies. Because of that, he was granted as the academician of the Chinese Academy of Science and Chinese Academy of Engineering, which this is the highest award for the scientific people. Before that, when he gets granted, nobody monitored this event. Then the man finally successfully gets the reward. So the surveillance system need to be further improved. And in addition, the surveillance system has trouble with data sharing and the data use. And also the capacity for surveillance is still limited, especially in local level. The seventh strategy is to strengthen capacity building and ensure financial support for tobacco control. As I mentioned before, various societies has involved in tobacco control. So it is necessary to capacity building for those people. We have a success experience that before that we have many training courses for mass media reporters and let them know what's the harm caused by the tobacco use, and they know how to release some news to push the tobacco control later. So I think it's a quite a successful experience before. And also we should ensure financial support for tobacco control, especially on the surveillance systems, on the public educations, also on the research, which we can provide robust evidence for Chinese population. Also, during the Fighting with Low Tar, Low Risk Cigarettes campaign in 2012, we found there are only 2 academic articles against the Chinese low tar cigarettes. That is a shortage of research evidence. So I think that should be ensure the financial support. The 8th strategy is to build the coalitions of tobacco control, because as we know, various society communities has involved in the tobacco control, and we also have a good successful experience. In 2009, we formed the Chinese Legal Experts Panel of Tobacco Control. This panel contribute their huge efforts to push the smoke-free law at the city level. it is quite successfully, and we think if we can continue to expand the collaborations to other organizations or other peoples, maybe it's a good strategies. And also, there are 12 organizations involved in the steering community to implement the FCTC. So more social organizations, including party school at the national and the provincial levels, the Central Cultural Office, the China Women's Federation, the Chinese Community Youth League, the All China Federation of Trade Unions, and the large enterprise groups except tobacco industry will be involved in tobacco control in China. So that's all for my presentation today. At last, I will thank for my team members, especially for Professor Gong Huanyang. She's the senior consultant of our group, and most of the opinions and data from this book, Tobacco Control in China, edited by Professor Gong Huanyang. So thank you for your attention.
Great, thank you, Dr. Wan. Yeah, that was a great overview of many challenges and some opportunities for tobacco control in China. I guess I think you can stop sharing your screen now because we're still seeing that. And just wanted to note, so I saw there was one question that came in the chat during your presentation. So from Lisa Liu in the US, who asked, does tobacco tax revenue ever become a reason for the government to not crack down on the industry? So I guess, yeah, is a concern that the tobacco tax revenue generated is a disincentive for enacting stronger tobacco control policies.
Can I add to that?
Yeah, go ahead.
Yeah, so absolutely, it is always one of the reasons or the arguments that the industry is making in, to interfere with policy development, not only at the national level, but at the subnational level as well. Apart from the tax revenue that they contribute to the national government, they're also investing in things like building infrastructure for the local governments and contribute, I guess, to local development in other forms. So it is one of the most common arguments that they've been making, and it is one of the most important concerns, I think, among other reasons why there is always, I guess, it's always an obstacle to actually promote any policy development, but especially tax increase in China.
Great. Okay. Well, thank you. I know we have one more speaker to get to, and then we can continue the discussion after that too. So I'll turn it over to you, Dr. Wang, to take us through the next.
Thank you very much, Dr. Mark. Thank you very much, Dr. Mark. So next we'll have the speaker whose name is Dr. Nan Jiang. She's an assistant professor in the Department of Population Health at New York University Grossman School of Medicine. Her research focuses on mobile technology-mediated smoking cessation interventions. She has received NIH funding to investigate the use of social media, specifically WeChat, which is equivalent to like WhatsApp, to extend the research of smoking cessation and facilitate behavior change among Chinese immigrant smokers. Dr. Jiang's research also investigates the impact of e-cigarette characteristics, specifically flavors and device types, and cigarette marketing on tobacco use, as well as health effects of e-cigarette use. So without further ado, I'll hand it over to Dr. Zhang, please.
Thank you, Xiaojing. Thank you, Mark. So I'll share my. Can you see the slide?
Yes.
Okay. Okay. Hello, everyone. I'm very excited to share my work about development of a text messaging cessation intervention for the Chinese immigrant smokers in the United States. So some background about the study. The smoking rates remain disproportionately high among the Chinese immigrants, particularly for males. In New York City, for example, the city with the largest Chinese population in the US, the current smoking rate among Chinese American men is 28%, which is much higher than the general male population, which is 17.5%. An important reason for the high smoking rate is the low intention to quit. This is largely related to the low knowledge level about the harms of smoking and benefits of quitting, and also the strong attachment to the traditional Chinese social norms that support smoking in men. And the other important reason for the high smoking rate is the low use of existing available smoking cessation services. For example, the Asian Smoker Quit Line and also some community-based cessation services have very low engagement rates. And the reasons included the low awareness of existing cessation services, the interest about the treatment efficacy, the low acceptability of counseling therapy for making behavioral change, and also the time constraints due to the long working hours for this population. So to reduce tobacco use among this population, it requires new treatment approach that is engaging, acceptable, and also efficacious to enhance the quitting outcomes. As we know that the short messaging based interventions have proven efficacy. They can reach a large population and they can overcome the access barrier. However, the short messaging intervention have not focused on the Chinese immigrant population. So it's not known whether this kind of program can expand the reach and promote abstinence among the Chinese immigrant population. So we developed the study to examine the feasibility, the acceptability, and preliminary effectiveness of a culturally adapted WeChat-based smoking cessation intervention among the Chinese immigrant smokers. There are several components for this intervention, but the core is the text messaging intervention. And the first part of this study is to develop a message library. And we use the social cognitive theory to develop the message library. And this theory emphasizes the dynamic interactions between personal factors, for example, the knowledge, skill, self-efficacy, and the behavior and the environment. So using this framework, we have developed a message library. And in this study, we conduct the in-depth interview among smokers to assess the message to test the content relevance. So the method, we conducted in-depth interview among 20 Chinese immigrant smokers. Their age between 24 to 62 years old. And we have 7 female participants. And in the table, it shows the occupation of the participants. And as you can see, most of the participants are restaurant staff or hairdressers. So the interview started with questions about their smoking patterns, their quitting experience, their quitting intention. And then we conducted the message assessment part. So specifically, we sent 17 test messages to participants through WeChat. We sent out the message one by one, and participants need to read each message and give a rating on a 0 to 10 scale. And after they rate the message, we send them the second message. And then we discuss with the participants about their rating. We ask them what they like and what they dislike about each message, whether the content is relevant to themselves, whether the content is new to them. And also we discuss about the length and format of the message. We also assess their understanding. So we ask the participants to summarize each of the test message. That's our in-depth interview. So the 17 test message includes 6 messages about motivation, 3 messages about self-efficacy, and 8 messages about the quitting scales. Now here is the result. In terms of the smoking and quitting experience, 13 of the participants are daily smokers and 7 are non-daily smokers. And 13 people are cigarette-only smokers and 7 are dual users who use both cigarettes and e-cigarettes. And the dual users are primarily hairdressers and Uber drivers because they don't like the smell of smoke. In terms of the quitting attempts, 19 people had tried to quit, but only 1 people used the evidence-based quitting method. He used the nicotine patch and the gum. In terms of the quitting intention, 14 people said they want to quit. And then we asked them, why do you want to quit? And 11 people said they have the concern about their own health. And 2 people said because they plan to have a healthy baby. And 1 female said she has concern about her child's health. And then we asked the question, when do you plan to quit? What's your timeline? And we can see that in the table, 2 people said they want to quit as soon as possible. And another 2 people said they plan to quit after they finish the last 2 or 3 packs of the cigarettes. And one woman said she planned to quit in 3 or 4 months. And 2 people said they plan to quit when they are gonna have the baby. And 7 people said they have no plan on timing. So this is their smoking and quitting experience. And then we conduct the test when we conduct the message assessment. So for the first group of messages, it's about motivation. So most of the participants commented that they learned something new. They said especially about the harms of smoking and how exactly smoking damages the health. So for example, a male smoker said, I know there are lots of chemicals in cigarettes, which is bad for health, but I don't know the exact harms caused by smoking or how exactly smoking damages the body. The message provided detailed, comprehensive information about the hazards and explained very clearly how smoking affects health. I knew smoking causes lung cancer, but I didn't know it causes stroke and cardiovascular diseases. This information is new to me. And because most of the participants say that they become more aware about the harms of smoking, most participants said after reading the message, they are more willing to quit smoking. For example, 1 smoker said, the message specifically talked about the dangers of smoking, which scared me. As I was reading the message, I thought about myself. I was thinking, oh no, my heart cannot go wrong. I'm still young. So it's important to quit smoking. One of the motivation message is about the reason to quit. So here I show you our test message. It's pretty long. So we give them a list of 10 reasons for quitting. And we ask the participants, so in this list, tell us which reasons are important for you when you make the decision making, or what do you care about when you think about smoking or quitting. And we found that participants care about the health of themselves and people around them, and also a better environment. So they check the things like be healthier, look healthier, feel healthier, improve the health of people around you, live in a better environment, and enjoy better sexual and reproductive health. Very few people, only 1 or 2 participants check other reasons. And we are very curious about why saving money is not an important thing for the smokers. So we asked them this question: why saving money is not an important reason for you? And we learned that most of the smokers think smoking doesn't cost a lot of money. Here is one quote from a male smoker. He said, "A pack of cigarettes costs a bit more than $10. I smoke half a pack or less per day. So it's about $3 a day. This is not a lot of money, just like the price of a cup of coffee or bread. People don't spend hundreds of dollars to buy cartons of cigarettes at once. So people rarely think about how much money they spend on smoking for a day, for a month, or for a year. Very few people would do the calculation." So this is what we learned. For self-efficacy message, most of the participants said after reading the message, they are more confident in themselves for quitting. For example, one female smoker mentioned, "Years ago, I tried to quit but failed, so I gave up." This message mentions the importance of environment, which is the reason why I fail. It tells exactly what I thought. Reading this message makes me feel more confident in myself. And the other person mentioned, "This group of message provides me with encouragement. I particularly like this sentence. For most former smokers, it takes them several tries to find out what works for them. Each quit attempt, even unsuccessful, is a step forward. From my own experience, it's so true." So this is the self-efficacy message. So for some content, participants said it is exaggerated. So for example, a female smoker said, "The message that when people around you see how much you've changed and how happy you are, they will be inspired to change with you. So you are shaping your families and community through your change." This is exaggerated. Is quitting a big deal? No, I don't think so. How can it shape the community? And similarly, another person said, "I don't think other people really care whether you quit or not. When you quit, you may feel good about yourself and think you are successful, but it's not a big achievement. Quitting smoking is just an ordinary thing. It cannot inspire others." So people don't agree with this sentence just because they think quitting smoking is not a big thing. For the skills message, participants rated very high for this group of message. They describe this message as useful and relevant to themselves. So for example, one person said, "The suggestions are very concrete and they convey everything. They cover everything. I cannot think of anything that is missing. The information is comprehensive, complete, and perfect. As long as you follow these suggestions, you will definitely succeed. The information is good for anyone." And the other person said, "Oh, the content is so comprehensive. It tells you what to say and what to do. very detailed information. So we also hear people saying that for some of the quitting skills, we put in the test message, people have different opinions. For example, about the securing social support from families and friends, people have different opinions. For example, one female smoker said, if I decided to quit, I will tell my family and friends. I will ask them to remind me. I think it will be helpful. But a male smoker mentions, I will not purposely tell others that I'm quitting. It's your own business. If you make up the mind to quit, just do it. Other people have limited influence on this. So we observe that for most of the female smokers, they think, oh, this is a good idea. It's a good idea to get support from people around you. But for male smokers, they don't think so. They think this is their own business. So very different. We also hear people talking about the challenge in applying some of the quitting skills. For example, about redesign your environment. Smoker mentioned that they have so many friends or co-workers smoke. So it's very hard for them to have a supportive environment for quitting. For example, a female smoker said, I work in the kitchen, all the cooks smoke, so it's impossible to have an environment that allows me to quit. The second challenge is about coping with stress. So for this population, the Chinese immigrant smoker, it's very common for them to have long working hours. So they have high level of stress. And many of them find very hard to use other way to deal with the stress. And especially for the restaurant staff, they say smoking is the only excuse for them to take a working break. So for example, a female non-daily smoker, she said, I only smoke during the working days. The kitchen work is super busy. Sometimes I'm so exhausted that I don't have appetite to eat anything after work. So at work, every few hours, I tell the manager, I need to smoke. Then I can take a break and relax for a few minutes. So this is the comments from a non-daily smoker. The other important challenge is to coping with the craving. So during the interview, we try to explore with the Uber drivers, the restaurant workers, what might be the appropriate substitute behavior that is feasible for them to distract them during the craving. And it's very hard to find the appropriate way to distract them at work. So we don't have a solution on this. In terms of the language clarity, we asked the participants to summarize each of the test message. And we noticed that participants do not understand some of the terms, for example, quit date and substitute behavior. So when we mention this, we need to explain what they mean. And also how to translate these terms into Chinese really matters. And in terms of the length and format of the message, participants prefer to read message in bullet points. They don't want to read the large paragraph on their phone. So if the message is in the bullet point format, if it's not too long, I mean, if the message is just one screen, or if it's a little bit longer than one screen, it's okay for them. And this is the last slide. So in conclusion, we got positive feedback from participants about the test message. Participants feel that the message increased their knowledge about smoking, increased their motivation for quitting, and increased their confidence in quitting. They reported that the message provided useful, concrete, and comprehensive information for quitting. And also the message are relevant to them and the readability is appropriate. And we also received insights that are helpful for us to modify the message. For example, we'll change the format of the message, we'll clarify the terms in the message. So that's it.
Thank you very much, Dr. Jiang. This is a very informative presentation, and I should say it's a fascinating research. You know, because after the World No Tobacco Day this year, the theme is on you know, quitting, and then we're also in China, you know, exploring new approaches that we haven't explored before, in kind of in a way supporting the government's initiative, but also advancing tobacco control policy that we've been focusing on in China. And one of the things is really to try to start exploring sort of creating a community model to support smokers to quit, leveraging support mostly from the community level medical facilities, and with designated staff kind of doing the follow-up calls. So I'm sure we have a lot to learn from your research. So I'm really excited, you know, to hear the details from your research, and thank you for sharing the results. And it just happens that no, thank you. And it just happens that WHO did a message testing kind of research just recently. I mean, I don't think I'm in a position to share their results, but I'd say many of the findings from your qualitative interview or the analysis of the message testing are very much similar. So it'll be great to compare the two sort of research in further detail, maybe offline. And I see there's a question in the chat box. Sorry, I'm trying to find it. It's from Lisa Liu. And the question is, how can we engage youth to advocate for tobacco control if the government structure doesn't allow grassroots movements? And studies are mostly concerned with academics instead of social issues. Do any of the speakers wants to take that question?
And I see there's another question below also about youth. You know, just pointing out youth are key to help getting other youth to stop smoking, because youth smokers may be more responsive to messages from their peers rather than from adults. So yeah, any perspectives on the role of youth, I think would be great to hear.
I guess I can start. So I'm not sure if the government structure is the same in places that we work in, but in China, within the government structure, there is a government agency kind of leading the youth group in China, and it's part of the, well, it's not part of, but it's led by the Communist Party. So we do have that infrastructure in place. But in terms of engaging youth, apart from leveraging government agencies to initiate youth-targeted campaigns, we're also working with civil society organizations to, mobilize youth groups as volunteers to participate in tobacco control, as well as launch campaigns targeting the youth group. The reason, as I mentioned in my presentation, is because one of the reasons is because there's no opposition towards protecting the youth from tobacco harm. So it's really a good leverage point for us to promote tobacco control policy in China.
I want to respond to the Lisa Lu's questions. He asked, how can we engage youth to advocate for tobacco control if the government structure doesn't allow grassroots movements? I think maybe here she has a little bit of understood here, because the government allow the grassroots movements, they don't prohibit the grassroots movements. In the previous years, I think most movements was grassroots. We have many NGO involved in the tobacco control, and they also have conducted many tobacco control activities. So I think the government allowed the kind of some kind of the grassroots movements. That's my question answer.
And sorry for jumping in, and just add to that, I think the youth group, at least in China, and I think it might be true in some of the other places, is that they're one of the groups that are relatively easier, or easiest to reach, because for example, you can reach out to them through entities like universities or schools, or even some educational institutions for educational purpose, or other, or engaging them in other tobacco control activities. But one problem with that, or one issue with that, is because that the student group, they come and go. So unless you engage them through a sustained mechanism, or continue to follow up with them after they graduated from the university or the schools, it's hard to sustain that group or that force in tobacco control, I guess, cohort, just in general. So that's one thing that we need to think about.
Great. Well, I had a question to ask the group. If we don't have other questions in the chat box, I guess one thing I was curious after hearing, all three presentations is, so the one thing I didn't hear about was the use of sort of large-scale media campaigns in China. That may just be my own lack of awareness about it, but we know there have been smoke-free laws, passed at the city level. There have been tax increases, other kinds of, advertising, marketing restrictions. But one of the things we've seen has been successful, and I guess I'm thinking of my own experience in the U.S. is, the TIPS campaign for smokers, which was a great way to kind of get the message across for smokers to tell their own personal stories about how they were affected by smoking or their family members. And it strikes me that those kinds of messages can be really powerful. So I guess I'm curious, is there any sort of corollary to that in China?
I can take that question. So yes, it is important, and we've been actually using mass media campaign to support policy advocacy, throughout the years. And two most, I think, recent and relatively influential mass media campaign that are local partners, international partners working locally in China, have worked with the government, specifically NHC, to launch in past years, including a victim campaign telling the story of tobacco victims, how they lost their loved ones or how their life was in danger and how that was saved because of the tobacco interventions. And that was supported actually by government in-kind in-kind support, and not direct funding, but using the Chinese sort of central media system to broadcast it at all levels, and that was a big success. A lot of reads and hits, viewerships, and that's one of them. And then the other one was a campaign WHO did in collaboration with NHC and China CDC. I think this year is listening to the doctor, sort of using the doctor's voice to to send the message of why is it important to quit and the reasons why you should quit immediately, and leveraging some level of support of COVID, pandemic as well. And that's been well received at all levels as well. We've heard feedback from local government agencies or public institutions who launched the campaign at the national level, following the message used at the central level, that they've also got good sort of media coverage and positive public feedback.
Great, thanks. So it looks like there's another question in the chat too. So I see Rudy asks, in Thailand, we have a nursing student club to create a smoke-free society. I think as nurses, we should be involved in tobacco control and policy. So I don't know if any of the speakers want to comment on the role of nurses.
Well,
okay.
Go ahead, Dr. Wan.
Okay.
I've been talking too much.
Yeah. I think we are also have something like that. Not the nursing. We have a students college club like that, and but we have a notice on the doctors and the nurse to create the smoke-free environment in China. So I think in our country, we most of the doctors and the nurse can involved. Yes.
And if I may just add to that, one of the very first tobacco control or smoke-free movements we conducted in China is smoke-free health facilities, and obviously doctors and nurses are the key stakeholders. And one thing that China CDC, as the national tobacco control, I guess, lead agency, is doing is to try to promote the brief cessation interventions, the ABC model, to doctors. So, and I think that includes, all medical professionals trying to leverage their support in, asking smoking behaviors when they have a doctor's appointment with the patients, and then give advice to the smoking the patient, the smoker patient, for quit smoking. And also in some places, I think it's not like a nationwide action, is to try to refer them to the cessation clinics. And that's been ongoing, even though we haven't seen huge impact. But we're hoping with the Quit campaign conducted this year, there will be more positive progress in the coming years.
And also, I want to add something. Before, maybe in 2013, and the China Medical Board, they funded some money to the central examination, and for if the student become physicians or physicians, they should take an examination. So the central examination, they put some tobacco control contents into the examination. So I think that will help the nursing or the physician students to study to learn some tobacco control knowledges.
Yeah, and I would just add, so there is an organization called Tobacco Free Nurses, which has been very active internationally, and they actually have a website, and they have posted a lot of their sort of materials and things online. I don't know if they have materials in in Chinese, but I think they provide a lot of materials that organizations can take and adapt and use for their own purposes. So that's could be a helpful resource too. So another question that comes to mind is, it seems like one of the challenges in China, and I think this is probably true in other large countries too, is that tobacco control seems to move more quickly at the local level than at the national level. And that's certainly been true in the US and I think in other large countries. But I guess I'm just curious if that's, if you think that all the sort of progress at the local level will create some sort of momentum to make change at the national level as well.
That's our goal and strategy, actually, because there are a lot of concerns and I guess different interest groups that has more like they will create more arguments like at the national level to promote comprehensive national smoke-free law, and also because China is such a large country with a lot of rural and really underdeveloped areas. So the strategy we've been using, not only because there are more opportunities at the subnational level, is really to create successful subnational level stories and experience and generate data and evidence showing that comprehensive smoke-free law, once implemented effectively, can really contribute to reducing of smoking rate, and using that as the evidence to convince and also show to the national government that this will work, even if considering different economic status of different cities and provinces in China, because it's the same at the provincial level. They all have rural areas and less developed areas. So really generating those local evidence is, I think, especially in recent years, key to help the decision maker make the decision in improving the policy.
So I think we have just a few minutes left. I don't know if there are any final questions or comments.
I guess we perhaps can end the session a little bit earlier since there's no questions.
Yeah, it sounds like that's it. But yeah, so thank you everyone for fascinating discussion and talks. Thanks for sticking with us despite being on this virtual platform. And I don't know, Xiaojing, if you have any final words you want to say as co-chair.
Yeah, I mean, it's been a very fascinating session for myself as well. Even though as a speaker, I learned a lot from my fellow colleagues, and I'm sure the discussion about promoting tobacco control policies in China is not going to end today, and it will be. We will face more challenges in the future, but challenges also bring opportunities. So I think we're not in a dead end, and we are finding new approaches and new strategies to continue the tobacco control momentum at all levels. So I'm just hoping using the opportunity of this international exchange, we can continue the discussion about China, but also beyond. And really hoping everyone stay well and safe in the pandemic. That's the most important thing.
Great. Okay. Well, that sounds like a good place to end. But yeah, thank you everyone for your participation, and enjoy the rest of the conference.
Thank
Have
you,
a good
everyone.
day. Thank you, everyone. Take care. Bye-bye.
Bye.
Bye-bye.